Hi, my name is Associate Professor Termpong Wongtawan, and today I will teach you about heart anatomy. Now I'm going to teach you about the external morphology of the heart. First, you need to separate between left and right heart. You can do it by palpate the heart. So the left heart you will feel thicker than the right heart. After that, you turn the ventral side up like this. The left heart will be on the left, the right heart will be on the right. You can see the middle line here. This is paraconal interventricular group. This group separate between right heart and left heart. Inside the group, you could see two vessels. The first one is left coronary artery, which straight come from the aorta. Another one is great cardiac vein, which will circle around the heart and will end at the right atrium. So now you can see the auricle, left auricle and right auricle. The auricle is part of the atrium. This picture is dorsal side of the heart. This is the right heart. This is the left heart. The middle line here is the right coronary artery, which emerges from the coronary fat here, which represent the white or yellow color around the heart. This picture demonstrates the structure inside the heart. Start with the right heart, the blood coming through the vena cava to the right atrium. You maybe see the fossa ovaris, which is used to be foramen ovale, which connect between right atrium and left atrium. And this one will be coronary sinus, which receive the blood from great cardiac vein. And you will see the muscle in the atrium we call pectinate muscle. This picture did not show clearly. After that, the blood will go through the right ventricle through the valve here called right AV valve or tricuspid valve, which will connect with the papillary muscle through the fibrous cord called chordae tendineae. In the left heart, you will be able to see this valve called the mitral valve connect with chordae tendineae and papillary muscle, and then trabeculae cornea, which is the muscle inside left and right heart. So the wall between right and left heart called interventricular septum. And after that go to the after the ventricle, the blood will go to the body through the aortic arch. And in this area, we have the valve called aortic valve, which did not see in this picture. This is the upper view of the heart, and you can see that I can identify four structure here. So let's start with left atrium and aorta and the right atrium here, and then this one I think is the right ventricle and connect to the pulmonary trunk. So how do I know this structure? Because I put the forceps to check that where is the hole go through. Okay, let's start with the left atrium. You can observe the left AV valve here, and then for the aorta, it is a special valve, look like this, like the cup, three cup together, and this is vena cava. Will go through this right atrium. So what is unique structure of right atrium is the the wall is quite thin, but they have a lot of pectinate muscle more than the left atrium.
Now we're gonna cut through the left ventricle. So you cut through at the middle of the ventricle and then you open it. So what you can see now is this one. This one will be the left atrium, collect the blood from pulmonary vein, and this is left ventricle, and this AV valve, and this will be the aorta, collect the blood from left ventricle, and this will be aortic valve.
This is structure inside the left heart. Start with the atrium with the pectinate muscle here, and then the left AV valve or mitral valve. So if we observe the AV valve from the upper side, you can see it look like the back that have one line over it, and then you got chordae tendineae, papillary muscle, and tuberculate cornea. The papillary muscle in the left ventricle is thicker and bigger than the right ventricle.
Now we can dissect the right heart. You just turn the right heart upside, and then you use the scissor or knife cut to the right heart at the middle, and then you open it. So this one will be vena cava, cut through atrium, and then the right ventricle. This is AV valve, and then this is gonna be pulmonary artery, and
This is structure inside the right heart. Start with the atrium first. You can observe the pectinate muscle here. This is a lot than the left heart, and you see the crista terminalis, which is found only in the right atrium. The crista terminalis is the origin of pectinate muscle. Then the right AV valve here. So the blood will go to the atrium, to the valve, and then to the ventricle, and then it will go to this way to the truncatus arteriosus, which is the smooth area in the right ventricle, and then it will go through the pulmonary valve around here, and then go to pulmonary trunk. This picture also the right heart. This is ventricle. This is the atrium. The big hole here is the coronary sinus that connect to the great cardiac vein, and this probably the fossa ovaris. This is the last picture. So the left image here is the left heart. So this is the ventricle here, and this is the aorta. So this area are the aortic valve, which you can see it look like the cup, and the hole here is the coronary artery, left one and the right one. The right picture here is the right heart. So A is atrium, B is the valve, and the blood will come from atrium to ventricle and through this area called conus arteriosus through the pulmonary trunk. Now is your time for this section.